Welcome to Mobile Crisis Response. This brief course is intended for first responders and provides an overview of the services available through the 988 Colorado Mental Health Line's Mobile Crisis Response MCR program. The MCR program provides on-site support to de-escalate a mental health crisis situation and improve outcomes for individuals in crisis. This course will help you know when and how to take advantage of this program. Let's get started. Take a moment to review the course objectives in detail.
Oh, I'm glad you're here. He's in the back room.
Get him off me! Make him stop!
How long has this been going on? Any idea what might be causing it?
He's had a few psychotic episodes in the past year. He usually calms down after a few minutes. But this has been going on for a while now. I'm not sure what to do.
If you're okay with it, I think we'd better transport him to the ER.
I don't know. We've been to the ER before, and they don't have the psych services we need.
Does he have a psychiatrist?
He does, but I can't get in to see them for 2 days, and I can't get him in the car when he's like this anyway. Aren't there any better options?
The MCR program is a partnership between state agencies and local mental health providers across the state. Mobile Crisis Response is a statewide service coordinated by the Behavioral Health Administration designed to strengthen crisis care services in Colorado. The program provides mobile crisis services for people in Colorado experiencing a mental health or substance use disorder crisis. Trained community-based providers go to where help is needed to de-escalate and stabilize a behavioral health crisis and hopefully reduce the need for emergency room visits, inpatient stays, and unnecessary arrests. Mobile crisis responders are trained crisis professionals who have completed the BHA's Crisis Professional Curriculum. This training includes crisis assessment, harm reduction, trauma-informed care, and other essential skills for crisis management. Responders are dispatched in teams of 2. One crisis professional will always respond in person, while the second may be in person or via telehealth, and are employed by crisis service agencies in the region they serve. These agencies are typically contracted by the Behavioral Health Administration Service Organization, although other arrangements are made as needed. MCR services are available to all Coloradans regardless of ability to pay or place of residency. MCR partners are located throughout the state with more than 15 community partner organizations. MCR is available to all people in Colorado 24 hours a day, 365 days a year. Once a request for mobile crisis response is received, the responders should be on scene within 1 hour in urban areas and within 2 hours in rural and frontier areas. Mobile crisis response provides both on-scene and follow-up care for individuals experiencing a behavioral health crisis. Mobile crisis response teams may respond to a variety of locations, including homes, schools, workplaces, libraries, and other settings where crisis services are not available. In some cases, a supporting crisis professional may assist an on-site MCR team member via telehealth. MCR teams do not travel to locations such as hospitals and residential or inpatient mental health facilities, other locations that already offer crisis services, or jails. While on site, the team provides individuals in crisis with crisis assessment to understand the individual's history and current risk factors, interventions and de-escalation that may include coping strategies and coordinating with other providers, safety planning that includes short and long-term strategies to reduce potential for harm, care coordination to connect the individual with necessary treatment, including transport to an appropriate facility if called for. After the initial contact, the MCR team will follow up with the individual or an authorized caregiver to assess their current state. This post-crisis follow-up should take place within 24 hours of the initial response, unless the individual was admitted to a higher level of care. Based on the outcome of this first follow-up, the team may conduct an additional check-in with the individual in crisis. The team may follow up by phone call, text, home visit, email, or letter. The MCR teams we've been talking about here are coordinated through the state and local partnership we discussed. In addition, some regions have their own co-responder and community responder teams. A co-responder team may consist of law enforcement working alongside a behavioral health specialist, and a community responder team may be made up of a firefighter or paramedic and behavioral health specialist. MCR teams may collaborate with a co-responder or community responder program in some circumstances. For example, when a request for mobile crisis response occurs after the local crisis response team's working hours, or if local resources are fully engaged. MCRs may also be part of community responder programs. While they may team with firefighters or paramedics, MCRs are prohibited from pairing with law enforcement. To request a mobile crisis response dispatch, reach out to the 988 Colorado Mental Health Line. You can simply call or text 988. But it doesn't have to be a first responder who calls. The individual in crisis or their family or friends can also access MCR services by reaching out to the 988 Colorado Mental Health Line, also called 988 Colorado. To access 988 Colorado, call or text 988 or chat on 988colorado.com. If the situation doesn't call for mobile crisis response, you can direct the individual in crisis to a walk-in center. The 988 Colorado website has more information about walk-in centers. Congratulations! You've completed the Introduction to Mobile Crisis Response. Here are the key points to remember. Mobile crisis response teams are trained crisis professionals who provide timely, on-site crisis assessment and intervention for people in behavioral health or substance use crises, as well as follow-up services to ensure continued care. This service is available to anyone in Colorado and is made possible by partnerships with local mental health organizations across the state. To access this service anytime, night or day, any day of the year, dial 988. Take a minute to make note of how to request a mobile crisis response in whatever way works best for you. Make a contact in your phone or commit it to memory so that you're prepared if the need arises. And remember, individuals, families, and friends can request MCR too to get the help and support they need. Thanks for completing this course. You can now close your browser.